Hello everyone, my name is Neha Ghosh and I will be taking you through a minimally invasive technique of Muller's muscle conjunctival resection. Muller's muscle conjunctival resection or MMCR is a surgical technique for mild upper eyelid ptosis correction. Muller's muscle is a sympathetically innervated smooth muscle present posterior to the levator of 10 to 12 millimeters length. The activity of the Muller's muscle can be assessed by the phenylephrine test, in which 2.5% phenylephrine drops are instilled in the eye and the eyelid position improves due to stimulation of the sympathetically innervated Muller's muscle. MMCR is known to provide good postoperative contour and cosmesis with faster healing than the anterior approach to ptosis correction. But the main drawback is the resection of normal conjunctiva, which can lead to damage to accessory lacrimal glands and conjunctival goblet cells. It is also contraindicated in cicatrizing conjunctival diseases, and it cannot address dermatochalasis through the same incision. A simple modification of the surgery by sparing the conjunctiva eliminates the conjunctiva-related drawbacks, and this video demonstrates the steps of this modified surgery, which can easily be emulated by surgeons keen to attempt this procedure. Once the patient is taken to the operating room, prepped and draped, a protective shield is put under the eyelids on the cornea. The eyelid is then everted over a dermal retractor, exposing the posterior eyelid tissues. Local anesthesia is injected into the subconjunctival space. Then a supratarsal incision is created. In this case, it is done with the monopolar cautery, and the conjunctival dissection is carried out superior to the superior border of the tarsus. The conjunctival flap is then reflected to expose the underlying Muller's muscle. Markings are made on the Muller's muscle following the 4:1 rule. That is, 4 mm of resection is done for 1 mm of required elevation. Then the Muller's muscle is held by fixation forceps, or in this case, stay sutures are passed through the Muller's muscle to lift it to facilitate the placing of the clamp. A putamen ptosis clamp is placed in the position incorporating the Muller's. Then, a 6-0 proline suture is internalized laterally along the base of the clamp through a bolster and run in a serpentine fashion. It is then externalized medially and then reinserted and re-internalized and run again in a serpentine fashion along the base of the ptosis clamp, exiting the skin close to the initial entry site, again through the same bolster. The medial and lateral sutures are then tied to each other. After that, tissue glue is placed over the anterior surface of the conjunctiva. Simultaneously, the Muller's muscle within the ptosis clamp is excised using a 15-number blade mounted on a Bart Parker handle. The conjunctiva is then draped over the posterior ptosis suture and the eyelid is placed back in its normal anatomic position. This is a young lady who underwent left-sided conjunctiva-sparing Muller's muscle conjunctival resection with a good postoperative eyelid lift, comparable to the outcome of the phenylephrine test. The advantages of preserving the conjunctiva are substantial. These include conservation of anatomically normal tissue and reduction of suture-related complications like corneal abrasion, since the conjunctiva is draped over the sutures and covers them during postoperative healing. I hope this video demonstration inspires you to try this variation of the procedure too. Thank you.